Hi everyone. Happy Tuesday afternoon, or maybe it's Wednesday morning where you are, but wherever you are, happy Tuesday. It's beautiful in Detroit. However, it's cold. We had a very warm weekend, and now we're in the I think it's the 30s or 40s. But nevertheless, we love that all of you are on. And today our topic is what does COVID do to the gut? So many of my patients who've had COVID have had problems with their gut. I want to talk about, is there a connection? So today we'll delve into that. COVID and the gut. Is there a connection? What COVID can do to the gut, right? So I'll talk about what COVID is, how it affects the respiratory system. Can it affect the GI system? Does it cause symptoms and what they could be? How about what we've been talking about, microbiome, gut health? Does that then do something to show the severity of COVID in the gut or not? So can we control it? To me, being a healthy hero is always about, can you control it, right? And then talk about the research. This is not just something we've observed, the research behind it. And again, call to action. What can you do to really help gut health as it relates to COVID? So we'll jump right into it. Again, let us know where you're joining us from. As always, we'd love to hear from you, and we're going to answer all your questions. So COVID-19, right? We know about it. We've been talking about it for 2 years, and it's a respiratory illness. So it's an illness of the lungs and the respiratory tract, right? But then, behold, so many people have had the GI issues. If you talk in China, the percentage can be up to 20-25%. In the US, traditionally it's a little less, but so many of my patients have had problems with it. So there's evidence that the virus that causes COVID can actually infect the respiratory and the gastrointestinal tract. So the lining of the intestinal tract, COVID can affect that. And studies show that the COVID can enter the intestinal cells and using protein that it uses, and that protein is in the cell membrane. So it's very, very important to make sure that, hey, you know what, this is something that the mechanism of the virus has to be able to get in. So what effects can COVID have on the GI tract? I hear so many of my patients who've been infected with COVID have these symptoms, right? Diarrhea, vomiting, nausea. Remember, the intestinal tract, our major job for the intestinal tract is to transport nutrients, right, from what you're eating into your bloodstream. And COVID disrupts that function, makes it more difficult for us to be able to absorb fluids, very important, and electrolytes. And remember, when COVID infects a cell, it triggers the release of something called cytokine. And people have heard about cytokine storms. And these are proteins that play a role in inflammation. So it's not surprising that these cytokines can actually cause disruption. It can stop you from being able to absorb nutrients, absorb fluids, etc. So that's why that inflammation can then lead to diarrhea, vomiting, nausea. When they do studies for example, in sewer systems, you can see evidence of COVID. One of the most accurate ways to be able to see what a community is doing is to look at some of the stuff that comes out of your GI tract, right? Now, does the new variant Omicron cause more gastrointestinal symptoms than the other variants? So really, when you look at nausea, diarrhea, and fatigue, this is not new to this variant, and it's not something that we're seeing more in the Omicron variant. Now, we've talked about it, right? We've established that COVID, even though it's a respiratory illness, it can actually wreak havoc, and it can cause GI symptoms, gut problems that so many of my patients suffer from. What can what you have, right, which is your microbiome, the trillions of bugs in your intestinal system, can that change how COVID affects you, right? So this is where I like not just talking about it, but here's where we can change things. We can change our microbiome and be health heroes. So the gut plays a major role in the immune system. Remember, the lining of the gut, they have trillion cells, they're lining the immune system. When our microbiome, bacteria, viruses, protozoa, are diverse, there's a lot of them and differences in them, what's happened is that they support the immune system that's lining the gut. So it then plays a role in how COVID can get in, right? When you have an imbalance, when you have more bad gut bugs, then what can happen is something called dysbiosis. I'll spell it Dysbiosis. And if somebody from my team could put that on, that'd be great. Dysbiosis. That's the imbalance. Important concept to understand is, but this is like a concert, right? All these bugs in unison. When there's an irregularity or imbalance, it's dysbiosis. And that dysbiosis can make us more susceptible to infections, including the COVID-19. And research is showing that the composition, the how our gut microbes are put together, right, that can actually change and influence COVID-19, how it affects us. To me, that's great. It's powerful because all the stuff we've been talking about last Tuesday, the Tuesday before that, can affect you from that. And the gut is not just a passive target. Now, it shows that it's actually the immune system in the gut can actually maintain and manage the severity of COVID-19. And so one of the most complex immune systems in your body, which is the gut. And then the disturbances, if you screw up your gut microbiome by eating pizza every day, processed foods, getting burgers, it's going to screw you up. So what about the research, right? What is the research that supports this? It's just me talking, out of what part of my body? No, it's actually has to do with research. Back in 2020, Centers for Gut Microbial Research, what they found that people with COVID-19 had distinct changes in their microbiome. So if you have not set yourself with the right microbiome, you may be affected more. Fecal samples, so stool samples, people with COVID-19 contain more pathogens, right? And disease-causing organisms. And recent research right now, coming, it's not 2020 anymore, new studies show the first evidence that there may be a connection between, remember that word, dysbiosis, right? And long COVID. And you don't have to have dysbiosis. You can have a great, strong microbiome. Our Superfoods Cookbook, we'll put this on the link for you. Many of who know and follow the Dr. Nandi show or our website, AskDrNandy.com, know that will be able, the Superfoods Cookbook is chock full of stuff that'll help your microbiome prevent dysbiosis. But this imbalance, right, or this dysbiosis can also be implicated in persistent inflammatory symptoms. You know about long COVID. Many of you have heard about long COVID. It can actually be something that can make long COVID worse. So when you look at the research, 274 stool samples showed that the makeup, meaning that what's in the gut microbiome, was very different between patients with and without COVID-19, right? So it didn't matter if they had been treated with drugs or antibiotics. The gut microbiome was different between people who got, the COVID-19, the type of infection that they had. And COVID-19 patients had higher numbers of a genus called Ruminococcus gnavis, GNAVUS. Ruminococcus, those species, and also Bacteroides species, than people who did not have the infection. Very important, because you can then see, hey, if you have these types of microbiome products, right? If you have these kind of species, you can then be more of a target. There are far fewer of the species that can help your immune system, right? Such as Bifidobacterium. We talked a couple weeks ago. Bifidobacterium species and Faecalibacterium species and Eubacterium species. They had lower numbers of those. And so when you see that, that's protective. That helps your immune system. So I'll say it again. We can even write it down. Bifidobacterium, right? People who had fewer of the species that can help the immune system, they had more infection. Makes sense, right? So this is how you can really custom make your immune system. And next week we'll talk about, hey, I got the microbiome. How do I know if I've got this, whatever he said, Bifidobacterium, right? How do I know if I've got whatever species? And we'll talk about, how can you now know the makeup of your gut microbiome, then to affect what you can do to change that, right? It's very important to understand. So COVID-19 infection prompts the immune system. It makes the immune system to make these cytokines like we talked about. These cytokines are inflammatory mediators. They make inflammation happen. And when this becomes excessive, we call it a cytokine storm, causing widespread tissue damage. And if you ever heard people in the ICU getting septic shock, their blood pressure is gone, all their organs are failing, this is that storm of stuff. It's supposed to help you, but when it's excessive, it can kill you. And blood samples showed that the microbial imbalance, right, found in the COVID patients were associated with elevated cytokines and something called C-reactive protein. You may have heard of that. Many of you may know what C-reactive protein is, and enzymes. And so it shows and it suggests that the gut microbiome, which we've been talking about, the trillions of bugs in your intestinal system, might influence the immune system response to COVID-19. Isn't that incredible? What is in your gut and what you're eating can help this disease that's going into your lungs and your respiratory system. To me, that's incredible that you can make a change, right? This is why, we haven't talked about it today or before, but sleep is a huge factor, right? To change your health, change your microbiome. So can having the right diet. When we talk about the 5 pillars, having the right diet, having the right mindset, make sure you move with purpose. So observational studies, and we need future clinical trials to show, hey, can we then use probiotics, different kind of supplements that can change your microbiome, and perhaps with the next pandemic or other infections, can you change the paradigm? Can you put it towards your favor? And that's very cool. So what can you do to help gut health? And we talked about Superfoods Cookbook. Bam, get it, please. It's chock full of stuff that can really make your microbiome and uplift it. Really, really important. You can do that. And then the diet, the Western diet, not very diverse. Get away from the fat, especially bad fats, right? Processed fats and sugar. And you want to be able to get, I love the Mediterranean diet too. Diverse range of foods, vegetables, and I love legumes. I'm Indian, and many of you are watching, maybe Indian. It's dal, D-A-L, legumes, beans, fruit, fermented foods, right? These are natural probiotics, prebiotic foods, whole grains, foods rich in probiotics, very important. As I've always talked about, until we can get other information, other ways to be able to get through this, get vaccinated, boosted. All of my family, except for the kids who cannot, have been boosted. Right? Wear a mask if you're not vaccinated. N95 is the highest quality, very, very important. Right? And I'll tell you the evidence showing that when you're boosted, vaccinated, man, it's so high. The evidence showing that you can prevent things like gastrointestinal symptoms and also long COVID. So very cool. So again, in summary, COVID-19 can affect the gut, and you're powerful. You can actually do a lot to be able to fight that. I'll say hello to some folks that are joining us again. Thank you so much for joining us today on our live. And Jason Skeens, hello from Flat Rock, Michigan. Thank you for joining us. Christine Sullivan, thanks for welcome back again from Port St. Lucie, Florida. We got to visit you down there at some point. This craziness with the weather we have here in pure Michigan. It's 80-degree one weekend, then it's 30 the next. Hannah Miranda, hello, Dr. Nandi, watching from the west side of Detroit. Love that. Thank you, Hannah. Tommy Esteves, plant-based is the way to go. And I appreciate you saying that, Tammy. I think that plant-based is the way to go. Whole food, too. People say they're plant-based when they have some processed gargantuan stuff. The processed foods is not great for the rest of your body, right? You want plant-based whole foods. Very, very important. Food that you can see. And Cali, we were just in the kitchen right before coming here, and broccoli was there, green beans was there, food that we can see, whole foods, plant-based. Bam. We have yogurt every morning, probiotic foods. We try to have fiber in our diet, prebiotics. So we do this stuff that really can change the whole paradigm. Karen Terrigan, one of my awesome friends and patients, doing well. Thank you so much, Karen, for joining us. Nancy Chatham Lyons, hello from Florida. I forget where in Florida, Nancy, remind me. And then Tammy Estevez says we all need fruits and veggies. I have them every day. So blueberries, one of the best foods I have. Antioxidants, has amazing medicinal properties, and it's delicious. So all of us like it. Michelle Toole says, post-COVID gut issues, and what protocol would you suggest? And I think here's what I would do. I think that and I'll talk about this, right? We have to be able to change the microbiome in a fairly rapid fashion. So you want to put prebiotics and probiotics so that you take the billions of bugs you have in your intestinal system and really amplify it. I also would recommend avoiding all processed foods completely. If you've had that, have whole foods. And I would like to be able to have them better cooked so that you can process them a little bit better. Remember, I talked about the cytokines that can really ravage the intestinal system, and it would be difficult sometimes to be able to absorb some of the more complex foods quickly. And so you want to be able to cook some of the fruits and vegetables a little bit more than you normally would. Christine Sutherland says, my husband had COVID since January 2021, left him with a horrible cough. It's really important to talk to your doctors about this and make sure that there's no residual. Christine, it'd be important to know what his chest x-ray shows, and what's the residual effect in his lungs. Dulce Valdez, thank you so much for joining us. And then let's see if I can go. Charles Boyunzio Muyanzi. Sorry about that. Hello, members from Uganda. Awesome. And he has got herbal remedies. Thank you, Charles, for joining us. Oren Goodman, thank you from Toronto, right, for joining us every week. And then let's see. Tammy Estevez, gut and brain together. Very important. You talk about that. The gut and the brain. We've talked about that. There is one of the largest, connections with the vagus nerve, direct connection from your gut to brain. So, people who have, brain fog after COVID and often also have gut issues, there is a connection. If you can change your microbiome, change your gut health, you can also immensely help your brain as well. So very, very important. And then let's see. And Christine Sutherland says, I love Dal. Kathleen Robotnik. Hello, how are you? Your last name is one of the favorites of my kids because Dr. Robotnik, right? I think it's Dr. Robotnik. In the movie, Callie can tell me what it is, but it's the little speedy guy that goes around and around. But thank you for joining us. And Fave Kuchumba, can diabetes be reversed? If yes, how I need to learn. The important thing about diabetes is it's an autoimmune condition, right? So you want to be able to take away inflammatory stimuli. So you want to, again, not eat processed foods. Try to avoid artificial fats and artificial and simple sugars. You want to be able to eat whole foods, and you want to be able to have antioxidants. So remember, movement with purpose is very critical with diabetes. So important. Callie said, we made turkey chili the other day and added 1 million vegetables. Yeah, we do this. We love it. And we practice what we preach. It's very, very important. Faye Rogers, one of our wonderful friends, joining us. I appreciate that. Very, very important. Carmen Murillo, thank you for your knowledge. Saginaw, Michigan. Love Saginaw. And Sonic is the movie. That's right, Callie. Sonic's the movie. Robotnik. I hear it for years. So thanks so much. Hey, guys, if you have any more questions, let us know. We'll get them answered. But I appreciate it. Next week, we'll talk about the microbiome and how do you test your own microbiome, right? How do you find out what your microbiome is made of so that you don't have to worry about, hey, is this going to be helpful for me? Is it not going to be helpful for me? I think it's important that one size does not fit all. And I just talked today about COVID-19 and how it can affect your immune system and how it can affect your gut. It's important to know that if you do have the right microbiome, you can make an effect. And so we'll find out next week what is your composition of your microbiome? How do you go about finding out, and can you make a difference so that one size does not fit all, right? So you want to be able to make it custom. And we'll join you next week on Tuesday at 5:30 Eastern. So love for you guys to join us at that time. Again, until that time, remember, make healthy living a part of every day, and namaste. I will talk to you real soon. Thanks so much.